Welcome back. We are answering your questions about COVID with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. So this person texted in, how long do symptoms stay with you when you're exposed to the variant?
It really depends on the individual. If you have just a minor disease, or do you get so sick that it requires you to be hospitalized and perhaps going to the ICU. So I would say similar to last year's strain. I think minor disease folks can be ill as much as just a few days, that I've heard, if you've been fully vaccinated, versus a week to a couple weeks, depending on your age and some comorbidities.
Mm-hmm. So this person said, when should you go to the hospital? When your chest is tight?
So yes, if somebody is exposed to, has had a close contact to COVID, we want you to, go get tested. If somebody has like cold-like symptoms, please go get tested for COVID. However, if you're starting to have shortness of breath, where you're having difficulty breathing, or chest tightness, that really requires you to seek medical attention.
Okay. Why is Cone not opening the women's hospital for COVID patients?
We even get that question asked internally. When we had the COVID dedicated hospital last year, it was really an extension of a lease, and unfortunately that was not an option anymore, so that hospital has been decommissioned. However, we do have capacity within our healthcare system to care for patients throughout our different hospital sites.
All right, this next question is, do we get the booster shot and the flu shot at the same time, or do we get them weeks apart?
So you're able to get the vaccines at the same time. Again, if somebody's immunocompromised now, please get your vaccine, your third dose of like kind of what we consider the primary series. And then towards the end of September, we will likely hear from the CDC and the FDA about receiving the boosters. And so I anticipate that a lot of us will be eligible to getting the boosters come the end of September, beginning of October.
And then this next question is, what about those home kits? Are they any good?
So those home kits, there's a couple types. So, the ones that are PCR testing is considered more sensitive than the antigen kits. And some of the antigen kits you can find at the grocery stores, which are roughly, I think, about $24. And with the antigen kits, I actually feel like they can be pretty sensitive because they're asking you to do testing like twice within a 48-hour time period. And that increases also the sensitivity. The Delta variant strain has like 1,000-fold viral load. And so I definitely feel like the antigen testing can be useful. If you're still having symptoms and your antigen test is negative, I would seek PCR testing or evaluating by your primary care doctor.
Mm-hmm. And all of those tests are a little bit different because it's different time period, different invasiveness of what they're able to test?
So no, I think it's just the different technology. PCR testing tends to be just more sensitive, and so it can pick it up longer period of time. The antigen testing you shouldn't do if you've had more than 5 days of symptoms.
Okay, good to know. All right, this person is asking, how many variants are there?
That's a great question. I think there probably is a lot more in store for us. We know that that many viruses can continue to mutate, and be it they're given different names of strains, or as we're using Greek alphabet for SARS-CoV-2, but there's a definite Lambda strain. There are likely others, and it really just depends like how predominant they are and what uniqueness in the mutations that they have.
Okay, and if you have the vaccine and get COVID, do you still treat with antibodies?
So, yes. So when you get vaccinated, right, your body produces your own antibodies to protect you against severe disease. You can likely still get infected and have mild disease. That's why we have what we call breakthrough cases. And folks who have risk factors for severe disease, you have an option of getting a monoclonal antibody infusion. And so that is also where you go to an infusion center and you'll receive a one-time infusion, and that helps actually like another form of like antibody protection against severe disease.